Another setback struck efforts to resolve the prolonged doctors' strike on Friday as discussions between government officials and the doctors' union collapsed once more. This extended the healthcare crisis that has plagued the nation for over 7 weeks now. Despite the emergence of a proposed return-to-work formula, negotiations aimed at ending the strike, which reached its 53rd day on Saturday, faltered.
We were in the Senate yesterday. The issues they raised today are different from the issues they raised in the Senate yesterday. So clearly there is a very consistent trail of dishonesty from the part of KMPDU and shifting goalposts. At the very tail end of the discussion today, they told us that they are willing to sign this document on Monday, having had these discussions for the last almost 7 hours. Clearly, that level of dishonesty is unfortunate.
Led by the head of public service Felix Kosgei, the government delegation convened with the Kenya Medical Practitioner, Pharmacists, Dentists Union in an attempt to reach an agreement. Despite their efforts, the doctors' union remained steadfast, referring to the Friday meeting as one of coercion than negotiation, accusing the government of failure to commit to timelines of implementation of the issues raised and the specific number of doctors to be hired, halting the progress of negotiations that seemed to be nearing completion.
The other issue that they have brought that was not there initially is that they want government to pay salaries to self-sponsored registrars. That as a doctor, you sit and say, now you want to go for masters, and you say you'll pay for yourself. So you get admission to a university, and now they're asking that we pay those doctors.
On payment of arrears for the doctors, the government came up with a 5-year payment plan, but KMPDU says they are willing to accept not more than 3 years since it is a debt long overdue.
You can't tell us that doctors don't have medical insurance and therefore the government will provide medical insurance. We ask you when. Then you say they will provide. We don't say you'll promote doctors and we ask you when will you do it. You say we'll commence in one month. So we'll commence in 1 month after for 2 years or when. They can't give that direction. We ask you about employment of doctors. You say we will employ. You say how, when, what is the plan on it? You can't give that. So the whole essence they're giving is blank statements that you cannot implement. More of the issues that we brought in the strike notice they're putting up as the network agreement. This can take 5 years. This can take 10 years. This can take 20 years. Because it has taken 7 years for them not acting on it totally. So if you don't give a commitment when you're going to start implementing it, then you are not acting in good faith. It is ill will.
Frustrated by the deadlock, the head of public service Felix Kosgei and the COG Health Committee chairperson Governor Muthomi Njuki have announced that the government will pursue legal recourse from the courts to dismiss the suspended doctors. They assert that service delivery has been greatly compromised.
Even as we are sitting here, the money that was set aside for interns, 2.4 billion, that is sitting in the account because they have not gone, they have not reported. The more they stay, we shall reallocate that money to go to other intervene on immediate and urgent issues like floods and other things. So we don't have luxury of time and we don't have unlimited resources. We don't have money that will accommodate all the requirements that our doctors need.
I think as a government, a responsible government, we have a duty to ensure that patients are being served. And that is what we'll continue to do.
We had initially said that we will not victimize the doctors who have been on strike. We still remain committed to the cause. However, it is not possible to stay like that forever. And therefore, in the event that we still do not have doctors back to work, we cannot let our people to continue dying. We will have no choice but to replace them.
The whole of the nation approach committee, which represents both county and the national governments, went ahead and signed the document. They say they will deposit in court on Monday as directed.
we shall ask the judge to allow us to intervene in all the measures that can be. One is he can go ahead and compel the doctors to report to work. He can allow the employers, the minister here, and the county government to recruit doctors to take charge as these people are picketing and demonstrating. These are the options that are there.
KMPDU officials have also indicated that they will sign a different document that captures their demands and deposit it in court on the same day as the return to work formula. David Kagina, K24, Nairobi.